This is Sg2 Perspectives, a conversation with Sg2 experts and industry thought leaders about the biggest trends in healthcare and what we expect that's going to mean for the future of healthcare delivery.
We need to recognize that how we define our value proposition for the consumers, for the community, for the payers in our market is going to have an impact and must be supported by our staff moving forward. We need them to buy in to you all as leaders as you set this mission and vision and how you define this value proposition, because if they don't, to actually deliver that in the market is going to be very challenging.
Welcome to Sg2 Perspectives. I'm your host for today, Trevor DaRin. I have three outstanding colleagues with me, Brianna Motley, Rebecca Limestall, and Brian Esser. We're going to talk through one of Sg2's most popular webinars of the year. Our kickoff for this year was Healthcare's 3-Year Horizon. We tackled a few discrete topics, teed up some big themes for the year, trying to push health systems to think about some things that ultimately we haven't heard that much about, particularly 3 years down the road. A, more systems are going to be tackling it, and B, those that do are probably going to look pretty different from those that continue to keep it on the back burner. Thank you all for joining me as always. Brianna, I'll go to you first. Why are we encouraging health systems to take a longer-term approach and look 3 years ahead?
We were excited to take a different approach this year, and we tried to push 3 years into the future for several different reasons. Number one, at our core, we are strategists, so we have to keep pushing our members to think about that mid and long term. It's ever important. It is challenging not to get mired in some of the day-to-day, ever-present challenges that we deal with as health systems, things like capacity, things like how do you embed AI. We know all of that is important to plan for, but we really wanted to encourage systems to think about and talk about things that we're not talking about today, but we do believe will have a material impact on how we deliver care 3 years down the line. Part of that is we need to start strategizing today if we're going to be successful in a healthcare environment in 3 years.
We've already started taking this on the road a little bit, and members are really anxious to talk about these topics because they're undercurrents. Brianna, what are the 3 big areas we're encouraging health systems to think about a little harder today and 3 years down the road?
We have been so pleasantly surprised by how much engagement there has been on these 3 topics. Let's go ahead and get to them. The first is value. And here it's hard to make sure that people don't anchor on value as value-based care. And we're encouraging systems to make that conversation bigger. It's about how do you define value? Who are you providing value to? And how do you make that clear internally and externally? The consumerism trend within the industry has been present and burgeoning for a while, but we're reframing that language to think about customer. And as an industry, there's an opportunity to think about who is our customer and how are we delivering value in a different way. Second topic that we were really excited about is integrative health. Here we're talking about coming back to that customer. If you're serious about meeting consumer or customer needs, then how do you start to reframe your goals and objectives for patient care beyond just the clinical? Patients don't necessarily think, customers don't necessarily think, I want to have better managed diabetes. They think about, I want a better quality of life. I want to be able to attend my daughter's soccer game. I want to be able to chase her down the field. So how can we think about holistically all of the solutions that we need to bring into the fold in order to be able to meet ultimately our customers' goals? The third topic that we explored is aging. And this was a fun one because it really stemmed from a question that was posed to us from one of our members. When do we reach peak bed demand? There's an intersection of forces that are dynamic and changing within the industry. Things like the physician retirement cliff, things like obviously the aging population. We have talked about rising acuity for a long time. We know health systems are building, in many cases, more inpatient beds to appropriately address demand. But when does that all flip on its head? So we did want to explore the topic of aging as well because of that intersection of forces that we do see on the horizon.
Really good framing and overview. Brian, I'm going to ask you to tackle the value section. Brianna said we're not talking value-based care, so what are we talking?
It's a good question, Trevor. When Brianna brought up the topic of value, we wrestled with what does that even mean? That's an all-expansive term that can go any which way. And yes, value-based care was my initial thought. And we've been talking about this for over 10 years now. But then we also said, what else could value be? It could be anchored in quality. It could be anchored in cost or patient experience. Value is held out to the community as you define it via your mission and vision and values dynamic. But what we don't see is a clearly defined value proposition for key stakeholders across your community, how you're engaging with the areas and their operating environment. Value proposition has been caught in this not terminology that continues to grow in a very expansive way, but ultimately is hard to unravel and clearly articulate to those that are engaging with us in our services. You and I went back and forth and said there's 4 key stakeholders here: the consumer, payer, your community, and ultimately the clinicians and staff that make up your workforce. And we really unpacked what have we advanced over the past few years with each of those stakeholders, and even more so, what are the next 3 years going to look like, and how should we evolve that value proposition in a much more meaningful way? But Trevor, you're part of the work effort. Take a couple of those and advance the discussion.
When we started debating consumers, we had a lot that we could have talked about in terms of places where systems made a good impact in the last 3 years around access, around, I won't say perfect data insights in this area, but it became an expectation that planning teams were trying to incorporate more consumer data. And most teams got more sophisticated using claims data as well to better segment their patients. That's a lot of progress in 3 years. The next 3 years, there's going to be continued tough, big expectations from consumers on health systems. And we boiled it down to focusing on navigation. The question we posed was, can you make a credible claim that you're going to be great ally, asset, navigator for patients to get through your health system? These guys are sick of hearing me say this analogy too many times to them, but I'm waiting for the billboard. I always get amused by looking at different healthcare billboards in different towns that says, we'll just make it really easy for you to get in and see a doctor. We'll help you make it easy and help navigate the system. I think that's what consumers want. We know how tough it is to deliver. The other area that I unpacked a lot through this research was thinking about the role in the community. Systems have grown through scale. Maintaining that community connection that small community hospitals have is understandably really hard to do as the scale of the system changes. It's as simple in some cases as the brand and people changing, and it's as complicated as different priorities around service distribution and resource allocation. How do systems maintain that local connection because it's invaluable for those that have it as they grow with scale? We pointed to Advocate's example on the south side of Chicago, pledging to invest $1 billion with a B dollars in that community. A big chunk of that is rebuilding a hospital, which it's a market with a traditionally really challenging payer mix. And thinking about it from just that perspective, it's probably not the place that would get the resources for a brand new, beautiful hospital first. And so that's a big piece. But there's also access in the community through new sites and workforce training. That's the role we expect from ourselves to play in the community, making big investments and getting big splashy headlines about it. But it doesn't always pan out that way. And there's probably still challenges for health systems to bridge the connection between local community and growing at scale. Brian, the other 2 areas where you dug in deeper were payers and then clinicians and staff.
The payer as a stakeholder continue to seek value from the system because ultimately they're our counterpart as we engage with our consumers. The last few years have been tense at best. That's a generous term between providers and payers at the negotiating table. And we've seen a lot of positioning by the providers in a meaningful way to defend their position and say we need sustainable rates moving forward and our value-based care platforms or others. And if those weren't seen or couldn't come through, a selective and deliberate pruning of the payer portfolio. The tension has been ratcheted up quite a bit on both sides. Moving forward, we as providers need to decisively define what is our ultimate value orientation. I'm not saying that's just value-based care, risk, shared savings, all of that. That's part of it. But who is actually buying this care from you? The employers, consumers in your market, what are they expecting to pay? And what is your ultimate outcome that you're delivering for that payment? At Vizient, we have fantastic clinical data. We're seeing an explosion of price transparency data in the market. Those that can blend those 2 data sets together and say, here's the actual value we're delivering on a quantified basis are going to continue to win the narrative when it comes to the negotiating table and even within the consumer and employer markets themselves. Thinking much broader beyond just traditional payer-provider relationships is going to be key. The last section here is our clinicians and staff workforce. Top of mind was with a group of CEOs early in January. Workforce is still the number 1 issue. And there's been fantastic work out there to focus on recruitment and retention, new on-ramps into the healthcare space for younger folks, high school, middle school, making this an area that they want to focus on. But we need to recognize that how we define our value proposition for the consumers, for the community, for the payers in our market is going to have an impact and must be supported by our staff moving forward. We need them to buy in to you all as leaders as you set this mission and vision and how you define this value proposition. Because if they don't, to actually deliver that in the market is going to be very challenging. That's the ultimate focus there on the clinician and the staff, recognizing they're our number one differentiator and competitive advantage moving forward. So our ultimate question we ask is who within the organization is defining this value proposition? And if there's no one tasked with defining that, who should be? And how will you ultimately unroll that across an entity?
I look forward to working through that question with systems in the next couple of years because they will want to tackle it. Rebecca, another area that systems are hungry to tackle is thinking about ways to integrate integrative health. Gonna have to work on that one, but that's not really a new term. How are we pushing systems to think about it in a new way?
Integrative health means the combination of traditional clinical care along with non-traditional health-related services that address their needs. But what we want to do is challenge organizations to think differently about their customers. What we know is that patients are more complex. They have higher acuity, whether you look at our forecast, you look at CDB data, you look at any data out there, our patients are suffering from multiple chronic conditions. That means they're presenting with multiple reasons and unknown etiologies at a lot of time, where a singular source of system of care may not fit the mold. They're also demanding more of healthcare services. They have demand for health and wellness services. That market has skyrocketed and continues to skyrocket across the global market, whether we're talking about fitness, health, and wellness apps. We're looking at weight loss. There's a number of reasons and peripheral players out there that are addressing the same market that we work with. Quite frankly, health systems, we haven't been able to fill those gaps that the health and wellness entities are trying to fill. Trust in hospitals and doctors has declined recently. We also know that leakage data shows us that in competitive markets, about 60% of patients leave the system. Those are key areas that we recognize has been a challenge for health systems. When I talk with many organizations and I ask them, are you differentiated and how? Their first answer is, yeah, of course, we're differentiated. But when we start digging into it, it's a challenge to identify how we look different to the market, how we look different to the customers, and how we're solving their problems. And that's exactly what we want to challenge our organizations to think about. Much the same way that we asked organizations to move beyond a procedure-based or site of care-based approach years ago into a system of care where we're thinking not just about an ED visit or an E&M visit, but thinking about an asthmatic patient, a pediatric asthma patient, for example, understanding the connection points from the ED to the E&M visit, making sure we have plans attached to that, preventing care. We're now calling organizations to go even further in that approach and integrate things that may not be part of the traditional care pathway. Things like apps for self-management of pediatric asthma, working upstream with some of the social determinants of health and making sure that we're connected with the schools. We encourage organizations to think about other areas like biologics, smart inhalers, technology innovation that's helping guide patients through the system and more accurately pull them into the right services. If you move past a system of care mentality to more of this integrative health approach, you would be addressing the needs of the patient, of not about I have this disease, I have pediatric asthma, but more, help me meet my healthcare goals. Help me return to playing on the playground. Help me return to having peace of mind as a parent of a child with asthma. Those are the things that we're looking to address and achieve through this type of model.
Rebecca, I like the concept. It's very understandable. Talk about how a patient's journey might look different if a system leaned into this.
There's a few organizations out there that are starting down this path of extending the healthcare journey, extending the care continuum, incorporating pieces of the puzzle that they may not have traditionally done. Cancer is a really good example of this. This is a service line that has embraced the system of care mentality by tumor type, integrating all the care continuum, but there's still gaps. There's still times when a patient needs to be seen between appointments, needs that triage of care. There's integration of other services like oncofertility or primary care or survivorship that comes into play. So we talk about examples, everything from Reimagine Care, which is a AI-based platform that partners with many organizations out there to create seamless care and triage patients between appointments for cancer, to the survivorship program at Duke, to community care plans that I just spoke with one CSO about recently. There are different ways to do this, to start integrating the pieces to the puzzle that go beyond our traditional care delivery and allow the patient to meet their goals. If any organization can make this easy for a patient, they will win the market.
Brianna, what's our imperative for systems to focus on aging? The two things seem adjacent, but we really called out aging as an area that needs dedicated thought resource strategies. Why?
One of the fun aspects we had was how much overlap is there between wellness and aging, which seem like they're at two opposite ends of the spectrum. One of the reasons we wanted to place specific focus in this area is partially because within our strategic conversations, we've been talking about senior care for quite a while. Members have been strategizing around senior care for several years now. When we took a look at that challenge, we wanted to make sure that members were addressing not just senior care in and of itself, but all of the different data points that intersect with preparing for managing patients in the future. We're talking about that aging population, but we're also talking about the implications from a workforce standpoint. So one of the stats that we know is that 30% of physicians delivering care today are over the age of 60. That has significant implications for how we're going to deliver care tomorrow. In addition, we've all been talking about advances in technology and how that's going to change care delivery. But the reality is that 68% of adults who are 50 and over don't believe that technology is designed with them in mind. It's not easy for them to use, to your point about the billboard and making it easy. If technology isn't easy for them to use, then it's not going to be a solution for how we're able to effectively deliver care to this population in the future. The third stat we wanted to bring into view and into the conversation, which perhaps is one of the more important ones, is thinking about the wealth gap and the fact that 43% of 55 to 64-year-olds have no retirement savings. So when we think about the infrastructure that we're designing to be able to care for an aging population, we really have to take all of these things into the fold. Do we have the workforce? Are they going to have the resources? Are we going to have the staff? And technology isn't a universal solution necessarily, at least as it's designed today, in order to help us bridge that gap. So one of our goals was to point out what we see as a significant challenge on the horizon and a need to do more than just come up with a senior care strategy, really to be able to stratify that based on the dynamics that exist in your local market and thinking about that customer, the unique needs of each of those individuals that you're going to be serving.
It's well said. And I know it resonates with systems because it's already baked into the way they think about markets, but now they know this is a segment they're going to have to really double down on. We built a stratification approach. How are you imagining systems could use that tool?
We have more work to do here. This goes to the goal of our webinar or our thoughts in general. We did want to set up these big conversations with more to come, more dialogue with our systems or analyses to come to bring to bear to help you solve these problems. But the stratification that we looked at was kind of interesting. What we did was take a look at the intersection of patient health on a spectrum from sick to healthy, and then resource availability, thinking back to what are they going to have available, whether that be retirement savings, long-term care insurance, just their overall vulnerability. What are they going to have available in order to put forth toward their healthcare as they continue to age? We came up with 4 segments as you intersect those two spectrums: well and wealthy, affluent aging, stressed and strapped, and slippery slope. What were the takeaways? As you think about your senior care strategy, you're probably going to have something different to offer to the well and wealthy who may be more focused on something like longevity care than you're going to have to need to offer to those who are stressed and strapped. You're trying to build that safety net in order to make sure that they can effectively manage their immediate health needs as well without the resources available to be able to put them in a long-term care facility, for example. Looking at the intersection of those two things, patient health and resources available, is a little bit of a more nuanced way. Now, we're always talking about segmentation at Sg2, and we're always coming up with what are the right elements to put into that segmentation model. Resource availability isn't something that we've seen put into that, and that's something that we would encourage systems to think about more intently moving forward.
A lot of 2x2s here at Sg2. Is that what you're saying?
We love our frameworks.
It happens. Brianna, even though this is kind of a kickoff to the year, these aren't the only research topics we're tackling. Can you give listeners a preview of some of the big areas we're going to tackle this year?
These are three big ones, and we will build on these throughout the year, especially as we approach our Executive Summit conference in July. So look for more to come on some of these topics during that meeting. But we're exploring a lot of things that are top of mind, both here and now and in the future for members. Ambulatory is absolutely one of those. The time has never been better to continue our coverage of ambulatory. And here we're really thinking about how do you take an ambulatory first mindset? We've also been asked some really interesting questions recently about quality and about differentiators. Quality is often one of those that health systems point to as a differentiator. We're trying to explore what some of the correlation of that is. Does it truly impact market share? Does it influence financial performance? How is it correlated with patient perception in your market? Is it as important as we think it is? That'll be a big topic for us this year. We're going to continue to cover and dive a little bit deeper into the advance of AI, into pharmacy and what that pharmacy system of care looks like. So lots to come from SG2 this year.
Thank you all for joining us to talk through SG2's healthcare 3-year horizon. Always a popular one with members, and I really appreciate you synthesizing it here. I look forward to having you share your perspective again. Thanks for listening. If you like this episode, please subscribe, rate, and review us, and or follow us on Twitter and LinkedIn at SG2 Healthcare. And if you want to talk more about innovative healthcare strategies, you can always email me at sg2perspectives@sg2.com. Finally, SG2 is a Vizient company, and there are a bunch of Vizient podcasts that you might like. You can find them at Vizient /podcasts. Have a great day.